Hi, my name is Aaron. I will be performing a donning and doffing kind of instructional video when going into a patient's room who has C. diff in the hospital. So the patient presents with dehydration and C. diff, which requires contact PPE to be applied to me before going into the room. So first thing we're going to do is we're just going to wash our hands. Really getting on other fingernails and other things and stuff like that. Making sure we're cleaning our hands before we go and start putting it on our gown. Alright. So then we'll come over here to our PPE station. Again, like I said, it was contact PPE, so I'll be wearing an isolation gown and some gloves. First things first, we'll take that isolation gown and put it on. Tying it in the back. Maybe. There we go. And then we're going to apply our gloves, with the gloves going on over the ends of our isolation gown cuff. I'm going to be wearing 2 sets of gloves, so that way in the case of doffing, or I needed to clean equipment or leave the room for any reason, I can take off 1 set of gloves, so that way I have a clean pair before going out into the hallway. That is the end of our donning procedure. If I were to go out into the hallway with my patient, they would also need to wear an additional isolation gown to kind of avoid any other further contact with the environment. But as for doffing, we'll start with our gloves. Take off our first set of gloves, and our second set we'll keep on. It'll be our clean set, and then we'll take off our isolation gown. And now we have, this will also be thrown away, not just thrown on the table. Now we have our clean set of gloves. We're going to use these gloves to help us clean and bleach any of the environment that we used, as far as like walkers, gate belts, or equipment used. After we're done with the bleach, we'll take off our other gloves, throw those away, and then come over and finish by washing our hands, since hand sanitization doesn't work with C. diff.